Great. Well, we're going to go ahead and introduce Lindsey Henke. Lindsey is a licensed clinical, let me get her photo, there we go. Lindsey is a licensed clinical social worker, a maternal mental health therapist, and founder and director of Pregnancy After Loss Support, an online magazine and peer-to-peer support service for the parents trying to conceive or pregnant or parenting subsequent to the loss of a child. And Lindsey, we're so thrilled that you're here all the way from Minneapolis, and I'm sure you're enjoying the weather, and you will see Lindsey is looking like gorgeous in her dress, not quite the flip-flops that we talked about before, but looking beautiful and is expecting herself as well. It's always fun to have someone on stage that we can relate to in that way. So Lindsey, come on up, and we're so glad that you're with us.
Thank you for having me. My name is Lindsey Henke. Like I was introduced, I'm a clinical social worker. I work with women in the maternal mental health field, and I also am the founder of Pregnancy After Loss Support, which is our little logo there. We call her many things. Knocked Up Nancy is one of them. But she's our lady. We haven't really gotten a term, but Pregnant Peggy is one too. But today I'm going to talk to you about mental health after loss and supporting moms pregnant again after a loss.
I'm going to just hold this microphone up because you cracked a funny joke and we didn't get to hear it. All of us didn't get to hear it, so you got to tell us that again. What do you call it? And then you can write
She's just called either Knocked Up Nancy or Pregnant Peggy. We haven't really figured out her name yet. But I also thought this would be more like a TED Talk, and when I lecture to my students, when I teach social work, I move around a lot to get my anxiety out, so I'm sorry, I'll try to stay focused around the mic. Well, then I'd feel like I was a comedian. So there's my information. And then the objectives today are to talk about mental health after a loss, and then to go into identifying symptoms of perinatal and postpartum mood disorders during a subsequent pregnancy and how to support the mom through a subsequent pregnancy after loss. So I can't really share my story as a professional without sharing my story from a personal level too. Like many, and it relates to the story that women go through and parents go through during a pregnancy after loss. But my first child, I was expecting in 2012, and that's where my story starts. Like most parents, our stories start with this innocence that Rana talked about, or that Kylie mentioned in her speech, that we have this innocence to be joyfully expecting our new child. And here's my husband and some pictures of our baby. But most parents start to attach early on to babies due to technology now. So you have that pregnancy test that you can pee on 6 days before your missed period and find out if you're pregnant. And when you do that, you envision a baby. You don't envision anything else, usually, if you get that positive pregnancy test and haven't had an unexpected outcome. So, and then other forms of technology along the way. I mean, your baby's first picture now is taken inside utero, and we meet baby on an ultrasound screen. So we're really attached. And then, unfortunately, the unexpected can happen, as the statistics show that Rana showed us. And then in 2012, December 30th, 4 days after her due date, my first daughter and first child, Nora, was born still, due to a fluke infection. Like many lost parents, we didn't think this would happen. We had a perfect pregnancy, textbook pregnancy, and then something happened where the story changed. Things were different now. In the months that followed our loss, we were ravished with grief, and we didn't really know how to navigate the world afterwards. We did the best we could. I think it helped that I was a therapist myself, so I had some coping skills. But I also am neurotic by nature, even before, it's just true, even before the loss. So I was at a higher risk for postpartum anxiety after my loss, and even more so after my subsequent pregnancy. So just to let you know how I got to be here today is because I founded Pregnancy After Loss Support, and 7 months after we lost Nora, we went on to become subsequently pregnant with our daughter, Zoe, who was born in March of 2014. And she's healthy, and now she's a 2-year-old, almost 2-year-old. But during that time, being pregnant with Zoe was probably the second hardest thing I had to do after losing Nora. And so that's why pregnancy after loss support came about. And what I noticed is that there's a lot of place for bereavement resources for women to go to for after a loss. There's a lot of great communities online. There's also a lot of great services that professionals know about, thanks to people like Rana and Resolve Through Sharing. But there wasn't a place for women to kind of commune and to meet, and even resources about a subsequent pregnancy that were readily available for women. So since then, we founded Pregnancy After Loss Support. Well, I did with a bunch of other women in, like 2 months after Zoe was born, in June of 2014, and we've been going ever since, and it's been a great resource for women to come to, and it's been thriving and expanding, and that's why I'm here talking to you about this today. So I will briefly talk about the feelings and the emotions and the mental health that happens after the unexpected, and then I'll talk about the subsequent pregnancy. So some of this was mentioned by Rana, but grief, we have to remember when we're treating the mom or working with the mom pregnant again after a loss, or even the dad, that grief is a normal and healthy reaction to any kind of loss from a person. And it's also a normal and healthy reaction to a pregnancy loss at any stage. Rana really identified that well, that in that study she referenced, that it doesn't matter how long the gestation of the pregnancy was when you lost that baby, you lost a baby. And the grief can be just as intense during that time. So grief can have its symptoms that show up as, it's an emotional reaction. So you have physiological symptoms, you have emotional symptoms, you have numbness, anger, guilt, sadness, and you have a body response as well too. So all that can be normal. When you're talking about perinatal grief, in comparison to grief of losing other loved ones, there's a couple more nuances or differences that need to be noted. So grief associated with pregnancy loss differs in ways from grieving others in that there's no shared history. You don't really have memories with this baby. You have a few, not a ton, but they're not memories with the baby outside of the womb. So there's no shared history. You don't remember their laugh. You don't know the color of their eyes. You don't know what their personality was like. And that can lead to some complications. It can also lead to just more grief that you didn't get to experience those things. There's also the attachment to the anticipated future with the unborn child that is no more. So you were going to have this baby, you had this idea of life together, what life would look like, and now it's no longer there. And that's some ways that it differs than grief we might experience from losing a loved one that we had time with on earth outside of the womb. Also, women who experience perinatal grief report experiencing feelings of guilt and shame, emptiness, sadness, anxiety, emotional detachment from others and also themselves. Kylie kind of mentioned this in her speech, how she was emotionally detached for a while, just felt like she left her body, which is the trauma response that we'll talk about that accompanies perinatal grief as well. And those somatic symptoms that we discussed or mentioned earlier about grief in general can have somatic symptoms, and then in perinatal grief, it does as well. The guilt and shame piece is an interesting one. It's one that is a common theme that runs through when we talk about complicated grief, which we will in a minute, when it comes to perinatal grief and loss. Because women feel like they might have had something to do with the fact that their baby died, which isn't often the case, but they feel like their body failed them or they did something wrong, which is a common theme. Kind of mentioned this already, but it's an important point. The intensity of grief is not determined by the length of the pregnancy. Just keep that in mind when you're working with women. I think Rana brought up a good point, asking them how they view the pregnancy in a gentle way that she recommended helps us figure out where to go from there. And that 75% is a big group of women who, when they saw that pregnancy test positive, they saw a baby. They didn't see whatever stage they lost their baby at. And then here's just a couple quotes talking about research that the thought is that if you've experienced the baby longer, the grief might be more intense, but contrary to these findings, like we've discussed, multiple studies show that to be not true. The intensity of grief does not depend on higher gestational age. Common themes in perinatal grief: a lot of isolation, a lot of loneliness due to the stigma and the silence. That's what Kylie and her husband Sean really has helped done and do for our community, is break the silence and make it a mainstream issue around bereavement and perinatal grief. But a common theme women experience is isolation and loneliness. I don't know if Rana can answer this question because she's been in the field longer than me, maybe when it's question time, but just how have we seen grief and acceptance of that grief evolve since Facebook? Gotta say it, I'm of that generation, and that's what we use a lot of our services for through pregnancy after loss. Or just having those stories out there in the community and more validation that this does happen, not to other people, which we think is what happens, but it actually happens to people we know, if we look at those statistics. And then, because there's isolation and loneliness, there's invalidation. And there's invalidation by the people that are often closest to you. Women report feeling that their loss is diminished by friends and family, the people that they want to reach out for and have support with when a loss happens. Something that if your grandmother died or your mom died, you'd probably get a lot of validation around. Yes, I'm so sorry for your loss. But sometimes people are just uncomfortable with grief in general, and they don't know how to help validate your experience. So then the lack of support from significant people in their lives is a common theme that perinatal grief women report. And then viewing the loss as a major life event. I can never say her name. She wrote My Sister's Keeper. Who wants to tell me her name? Judy Picolk or something? Jody, yeah. Maybe that's why I couldn't find the quote I wanted to show you today. I called her Judy. Whatever. She wrote this quote that goes around the internet that's really important. That's basically talking about how even though miscarriage is a common, and pregnancy loss, but miscarriage is a common life event, women who have had a miscarriage will 30 years later be able to tell you how old their baby would be. And so if you can do that 30 years later, you view your loss as a major life event. And that's when that's what the trauma happens to. If we're talking, they often view it as a traumatic event. Trauma is defined as something that's sudden, that's unexpected, and where you feel helpless and hopeless in the situation. And your fear for your physical safety, right? We know that in the room as medical and mental health professionals. Well, if you're experiencing a pregnancy loss, it's usually told to you in a sudden way if you experience loss at home, or if you go to an ultrasound technician and you're told when you go into the test or the whatever you're doing that you're expecting to hear a heartbeat and you're told your baby has died. It's sudden. And then it's also it physically happened to the baby inside of you, but it happened with inside of you. So there's that physical trauma that happens with a loss. And you feel hopeless because your job as a parent is to protect your baby, is to protect your child. And then you feel like you failed. So there's a lot of trauma surrounding these events. And most women will identify it that way. But again, as I've learned at a different conference, trauma is defined as if the client or the patient views it as trauma. So keep that in mind. And the other piece that I think Kylie and Sean and other people have been doing a great job at is breaking that silence. And we need to do that as health professionals by helping develop a language of cultural scripts, which I think Resolve Through Sharing does as well too, to bridge that gap between lost parents and greater society so they don't feel as alone. So complicated grief can happen after a loss. We got to remember though, I want to make sure you realize that grief is a natural response and non-pathological. But sometimes complicated grief can happen because of the common themes and the trauma that has happened to these women. So complicated grief just means symptoms are more disruptive, pervasive, and long-lasting than the normal grief response. Again, it's sudden, it's usually violent or traumatic, which women, the death was of the loved one, and women will define a pregnancy loss in that way. It also usually peaks within approximately 6 months of loss, and the same can be true for perinatal grief. So where do complicated grief and perinatal loss kind of merge? Well, their common themes overlap a little bit, and the women who actually experience complicated grief and then after perinatal loss reported feelings of that it was sudden and unexpected, like we talked about, so there's no time to prepare for the loss. Early losses, there's not that ritual that was mentioned earlier to kind of actualize the loss, actualize the experience that I lost something. There's the guilt and self-blame that goes into my body has failed me. And it actually, in some ways, research has shown undermines a woman's femininity, or I'm a woman, I'm supposed to be able to create life and carry life. Why was I not able to do that? So a lot of things come up. Risk factors for complicated grief are the same and similar to risk factors for PMADs after a loss, which we'll get to in a minute. But risk factors include a history of a pregnancy loss or repeat losses, so women who have multiple miscarriages that are a higher rate for complicated grief. I see you nodding your head, yep. Previous mental health history, which is usually a risk factor for any mental health diagnosis. Lack of social supports that Rana actually talked about, and social support is one of the biggest protective factors after a loss as well too. The more social support like that couple had, they're able to better process the grieving. Other risk factors for complicated grief, if your marriage is struggling or lack of support from your partner or invalidation from your partner about the loss, that can make it more complicated. And then two other factors, lack of living children, and if you have to terminate for medical reasons or decide to, can complicate your grieving. One thing that I usually talk about in our experience, when you lose, if you're talking about perinatal grief, when you lose a child during pregnancy or thereafter, you're grieving, like I said, the baby that died and what that person would have been like in those hopes and dreams. But in our case, my husband, and this happens a lot, and in Kylie's situation and other people's, I was also grieving my parenthood. I wasn't a parent in the way that I envisioned, and I think that's where the lack of living children comes in to complicate that grieving factor for some. Or one of their main goals for women who have multiple miscarriages is to become a mother, and they're grieving that as well too. So that's why it adds to the complication. And then terminating for medical reasons, you have to make difficult choices. And I like to validate the women who terminate for medical reasons, saying they're doing an act of love out of their mothering in the best way they know how. So, but it can complicate things. So when does grief lead to postpartum mood and anxiety disorders? Again, I'm kind of hammering home the point here, but some form of psychological distress often accompanies a pregnancy loss. Grief is normal. But when we have these other risk factors in there, and we've had this traumatic event, we are at a higher risk, or women are at a higher risk for experiencing postpartum depression and anxiety. And part of that too starts with how they're cared for. And I think that's right. Rana did a great job opening up today. If we can care for these women and men in a way to have that guided participation right after a loss, we can maybe mitigate against some of these things. We won't be able to mitigate against all of them, but we can help start the grieving process. So they originally thought that older women who've had multiple miscarriages were at a higher risk of PMADs. Some studies point to that, but a lot of studies have found that younger women are, mostly probably due to lack of coping skills. This might be the first major life event that happens to them, so that puts you at a higher risk. Again, previous mental health history during or before pregnancy is going to impact your risk factor for an anxiety or mood disorder after a loss. Research shows lower income, and also people who have had those complicating grieving factors, which just makes sense, are going to be more at risk for PMADs. Rana mentioned it, but the most common psychological disorders that are diagnosed after a loss are depression, anxiety, and within under anxiety, it's PTSD symptoms or PTSD itself. And the other one through research that I found that's rather interesting is, and I've seen this with some of my clients, is OCD tendencies. So they develop as rituals. I saw a client the other day who had an early loss, and then she recently is pregnant again, and she talks about how she has to wear the same pajamas to bed in order to prevent that loss. Has to do the same ritual before she goes to bed in order to prevent that loss. So that's another thing you'd probably see if we were in a non-complicated grief, or even if it was complicated grief, but that's definitely a symptom of a PMAD, right? Versus just a natural grieving process. So experiencing pregnancy loss places women at a higher risk for depression in all PMADs. Oops. So the next step in the journey is kind of my wheelhouse, pregnancy after loss. So I said we got pregnant 7 months later, which kind of fits with the statistic that's on here, and I saw Rana had as well too. 50 to 80% of women who experience a pregnancy loss, stillbirth, or neonatal death will go on to have a subsequent pregnancy within a year or 18 months after the loss. So I'm not going to talk a lot about what is recommended by OBs or psychologists about when you should be pregnant again after a loss. There's some controversy over it. I do think the things you need to take into consideration are what your physical health is doing and what your emotional health is doing, but it's also a personal choice. A lot of women want to become pregnant as soon as possible. If that's right for them, that's right for them, but also I think they should consult their medical providers as well. But what we do at Pregnancy After Loss Support and through a subsequent pregnancy is we teach women to advocate for themselves, and they know their body and they know their baby. They should get input from professionals, but they also should validate their own needs and emotions. So I work as a DBT therapist in my other job, so a dialectical behavioral therapist, Marsha Linehan model of treatment. So we do a lot of talking about the dialectical. And the dialectical is the idea that it's pretty cool. As a human, we can hold two opposite truths in our heart at the same time. So I always use this example. I can be mad at mom and I can love her at the same time, right? So pregnancy after loss is kind of like the biggest dialectical you can think of, because you have this continued grief and wanting for this child that died, and then you're expecting again, and you have this fear, but this hope and joy that maybe a baby could come this time. So you're walking this constant tightrope between joy and grief. And that is how we are made as humans. We should be able to do that, but it's not concrete, and it's really difficult, and it's hard to accept. So that's why pregnancy after loss can be so complex. And as one of my mentors and colleagues says, she's quoted here, she's done a lot of studying on pregnancy after loss. It's where she's focused her career. There's the continued grief for one baby while wanting to be happy for a new baby coming. So some of the common symptoms that are reported during a subsequent pregnancy are also common symptoms of PMADs. So in studies, women report high rates of symptoms of anxiety on the pregnancy anxiety scale, including increased fear and anxiety, more worries and stress, and reports of PTSD symptoms, depressive symptoms, and a continued grief, or as Joanne likes to refer to it in her work, as regrief. So I think Kylie mentioned this a little bit too, about how all of a sudden you're thrown back into the situation and all these emotions start to come up. Or in her case, I think you said they all started to come up after the birth. But anyways, both happen. And then we have someone in our offices saying, this is really hard for me. And the answer is, yeah, it makes sense this would be really hard for you. But that previous loss is a risk factor during a subsequent pregnancy for PMADs. And it's also normal to think that someone would be anxious during this time. I like to explain it as like you're living in your trauma. So, not that this is the best course of treatment plan, but if I got in a car accident and I decided that I never wanted to drive by that place where I got in that car accident again, I have that choice. You should probably get in a car again, but that's a different discussion. But you can avoid the car too. I can't avoid my own body, and I can't avoid, and I really have no control over what happened before in some cases. So then you're just living in your trauma for 9 months is what it feels like. And that's where that anxiety comes from. So common themes during a subsequent pregnancy. Rana hit on this too, that loss of innocence. There's a new definition of pregnancy. When I got that positive pregnancy test result, it doesn't mean that I'm going to come home with a baby. There's no guarantees anymore. And one thing that doesn't work if you're trying to reassure lost clients or patients, whatever you want to call them, is that statistically it shows, because now you've been that statistic. I just played the Powerball the other day because I thought maybe, hey, my chances are pretty good. But you don't believe in statistics anymore, and it's really hard to find reassurance through those things during a subsequent pregnancy because you have this new definition of pregnancy. You lose that innocence that everything will be okay, and the idea that there's a good outcome, or even the trust in your own body to help make that outcome happen. The conflicting emotions we talked about, Women report walking that tightrope between joy and grief, or hope and fear is a big one that's talked about. I'm really hopeful, but I'm really fearful this baby will die too. Some of the language that's used around that new definition of pregnancy is if, not when. So you'll hear women say, if this baby is born alive, not when I get to take this baby home, which can bother support systems. I remember talking to my sister, I would be like, if, and she's like, when are you going to realize this baby's going to come home? And I'm like, not till I have this baby in my arms. Because that's just wasn't my script. My narrative was changed with my first pregnancy, or the pregnancy of the loss. Again, that feeling of isolation. So one of the other reasons that pregnancy after loss support started is because of that isolation women often feel. They're forever changed by this journey, and they no longer fit in. So a little bit more about me. After my daughter died, I started writing. I didn't really know I was a writer. And I started writing my own personal blog, and then I started writing for Still Standing, which is a resource I actually recommend you give to your clients as just a place to start, to find other people who share similar emotions without having to join an online group or do much at all except read a blog post. And it's listed in here in the back. So I was a contributor for them. And then when I became pregnant again, I applied to Pregnancy Numero magazine to be their knocked up blogger. And note, my mom said, Lindsay, that's not a good term. And I said, I'm going to reclaim that term, Mom, because in her day it was kind of pejorative, I think. So anyways, I became their weekly knocked up blogger. And I held true to my story, and they wanted me to write about my pregnancy after loss. And then what happened was, when I would write in the bereaved community, now Still Standing is for child loss, infertility, pregnancy loss. It's a great resource. But everybody comes to that community very raw in grief. That's where I came as well too, into that community. And sometimes when you're that raw in grief, you're not ready to share or hear about other people's joy, or even the possibility that they could have a child when you lost one. So when I would talk about my pregnancy, I would get kind of, not because it was meant to be this way, because it just is, I would get told, people just wouldn't want to hear about it as much. We do talk about pregnancy after loss, and we are partners with Still Standing magazine as pregnancy after loss support, but it seemed like it was just too raw of something to talk about for people who had lost a baby, to talk about your subsequent pregnancy. So then I would write in Pregnancy Numero magazine, and they'd post on the mainstream pregnancy blog about my journey through pregnancy after loss, and I would talk about my loss. And I would get some pretty nasty replies, so I stopped reading the comments, but some of them were, why would you tell me this? I'm pregnant. And I'm like, well, I get that too, because I remember being that way as well. I think now we need to educate people that this can happen without scaring moms, but it made me feel really alone. And then what happens is that's what other women felt. So that's why we developed pregnancy after loss support, but that's just an example of that isolation. It's the idea that I want to go to a yoga class or a birth class during my subsequent pregnancy, but I'm going to have to be inundated with questions that people are just asking to be nice. Like, oh, is this your first pregnancy? How many children do you have at home? And all those are really triggering for someone who's in a subsequent pregnancy, because I'm just trying to be normal by going to a birth class, and all of a sudden I'm going to be ostracized from those communities for people who don't want to jinx their pregnancy or who might not understand. No fault of their own. Pregnancy is an anxious time, right? As we're talking about. So there's that feeling of isolation during this subsequent journey. And then there's that ambivalence. Kylie mentioned this a little bit, but that fear of attaching. Because if I attach, this baby might die too, and I'm going to get hurt all over again. So those are common themes that you deal with during a subsequent pregnancy. And again, the duration of the previous loss does not determine the intensity of the grief. So there's a conflict that comes up, I think, within mental health after loss, and then even during a subsequent pregnancy specifically. Are mental health symptoms during a PAL, that's what I call it for short, pathological? Some would say it's non-pathological, since the pregnancy anxiety is based on a real threat, that is, it's a justified anxiety, and we don't have to pathologize it. And that grief is a normal experience. Other studies show that women report these high symptoms of anxiety in pregnancy on the anxiety scale. They report symptoms of PTSD, and they report symptoms of depression. So my philosophy basically is, if there's symptoms of anxiety, why don't we treat them as symptoms of anxiety? And that's what we're going to talk about today, is how to, or for the rest of the presentation, is how can we walk with women who experience this anxiety. So there is evidence to support either way, if there's symptoms there that are pathological or non-pathological, that standards of care need to be put into place. And currently there's not a ton, but some really cool things are coming about, where if you look at that bottom bullet point, I know that maybe Rana or somebody else can help me, but the International Stillbirth Alliance just had their, I think they have annual conferences. And at that conference, the last one was in Canada. As of 2015, they developed a task force to consider standardized care for treating the PAL mom in general, which I don't know how fast it will come out, but it's a good start in getting some standards put into place, and how do you treat the woman who's pregnant after loss, their emotions as well as their physical health. Also, there's some current models of care that are pretty unique and looking into. There's Central Manchester University Hospitals. They have a Rainbow Clinic over in the UK, where they actually provide a lot of tons of added support around and for women who've had a previous loss. And we'll talk about what that kind of looks like in our recommendations here today. And then there's the Sunnybrook Subsequent Pregnancy Program. It was a pilot project in 2014, and that was in the Canada as well too, that had a similar model to the Rainbow Clinic. So based on the research I've done, my personal experience, my professional knowledge, and actually really just talking to the women I work with today, we've come up with goals on how to support, or what you can do to help the mom who is subsequently pregnant again. In areas of intervention, support, or resources providers can implement or include in their care of the PAL mom are basically these three goals. You want to nurture their grief. You want to validate the experience. You want to reduce the anxiety that's present. And you want to develop social support and access to resources so they know they're not alone. Women often identify in studies that they have high medical needs. That's supposed to say high medical needs. Oh, there it is. That are large needs of support during a subsequent pregnancy. I know, oh God, what's it called? The Star Legacy Foundation. It was founded by Lindsey Wimmer and her mom. She's had a stillbirth about 12 years ago. Her first child is Garrett, I do believe his name, and she's gone on to have 3 subsequent pregnancies. They're located in Minnesota. They're actually our fiscal sponsors. They're a great resource as well too. I asked her when I got, she's a nurse. I asked her when I got pregnant again, I said, is this gonna be awful? She's like, I went into my OB's office and said, I'm gonna be your worst nightmare. Because she realized she's gonna have high medical needs. I was the same way. So yeah, I think just knowing up front that it's okay to advocate for what you need is one of the big points we teach our women. And if you can teach your women that who are subsequently pregnant, that's a great start. Oh, all the pictures in here are of me and my children. It's not because I'm trying to be self-involved. It's just easier to get copyrights to my own pictures than from other people's that we work with. So just to let you know. So the first goal is to nurture grief. This is a tricky one. But first, what we want to do, we do this by attachment and validation. Validation of the experience of the loss. Validating can be through using the child's name that died when you're interacting with the client or patient. And also validating that this is hard. When we also nurture grief, we talk about attachment. And we don't want to force attachment to the new baby, but we can encourage attachment to the baby that died. And if we encourage attachment to the baby that died, we create space for the new baby in our lives. So maybe, I know I wasn't ready to think that this baby would come home, so I didn't want to read to the baby or talk to the baby or do those things that a lot of moms do during the first pregnancy, or put headphones on my belly. I never did that anyways, but some people do. But it did make sense for me to connect in some way to Nora, to make space for her, like Kylie talked about that they do at the Return to Zero retreats. Making a time to be with that child that died, letter writing, doing other things so that you can realize that you're not going to forget this baby. Part of the reason women don't want to attach is that anxiety of possibly losing the subsequent child, but it's also this guilt that if I attach to this baby, am I replacing the other one? when that's not the case. No child can replace another child, but it can feel that way. So facilitating the mother's and father's expressions of grief for one baby and attachment to a new baby helps preserve the space in the family that the dead child would have inhabited and makes way for the new baby. Some reasons women don't want to attach after loss. Parents report having less attachment and increased fear because they're afraid this baby would die too. I want to make sure you understand that that's a protective factor. These women are trying to protect themselves from another loss and grief. So when we're encouraging attachment, eventually there's this, Joanne teaches this model, it's called perinatal parenting. So the idea that it does help to attach during a subsequent pregnancy to the subsequent child, but you want to make sure that the client is showing, or the woman is showing you that she's ready. You don't want to force this attachment on her. And one way of not forcing it is in opening up to that attachment to the baby that has died instead. So ways so parents say they struggle to make plans for baby's arrival. You hear a lot of lost moms when they're subsequently pregnant say they don't want baby showers, they don't want gifts, they don't want anything. That's okay for them to set those boundaries. Using language like if instead of when, restrained expectations, and refusing celebrations until arrival. All common themes and can present as this fear of attachment because of the fear of the loss. So ways providers can help. Okay, so all the tips that we have in here or in the PowerPoint are actually out on the table in this document. You can print off from our website, or I gave you a whole bunch of handouts in the back. It's called Tips for Health Professionals When Treating the Mom Experiencing Pregnancy After Loss. It has 13 tips that are basically highlighted in this presentation, but it's a quicker version of looking at it. So providers can help by realizing one baby does not replace the other. Use the child's name that died when appropriate. That perinatal parenting, where you encourage attachment to the deceased baby, might be through letter writing, and then recommending bonding techniques when the mom and dad are ready. Sometimes the dad might be more ready than the mom, so that's something to take into consideration. But ways of doing that might be reading to new baby, talking to new baby, kick counting, but doing that and guiding that when the mom presents as being ready with that. I know when I was ready was when I was having conversations with my individual therapist, and it was farther along in the pregnancy, and technically if the baby was born, Zoe would have been viable, so it was probably after like 30 weeks at some point. And she's like, how would you feel if you lost this baby too? And that really helped me start to attach to the idea that I was going to maybe bring home a baby. So that was kind of our conversational cue that it's okay to start attaching. Other women will have other cues. So yeah. So the next part is to reduce the symptoms or to reduce anxiety. And how we do this is kind of how we reduce anxiety in practice overall. We develop coping skills and those advocacy skills I really talked about, teaching your moms that they can advocate for what they need. It's their body, their baby. They can go in and get reassurance and say that they're concerned about something. Provide medical reassurance when appropriate. I'm not saying reassure a mom if something's wrong, but if there's nothing wrong and they want to run a blood test and it might cost a little bit more, but they're willing to pay for it, let them run that blood test to ease their nerves so that they're not running around hyped up on this anxiety the whole time. And then also normalize PAL as a normal experience. It's normal for you to feel this anxious during this time. So recommended intervention methods include individual therapy or therapeutic support groups that can offer. I'm not saying everybody who goes through a subsequent pregnancy should do individual therapy or would want to go to a support group, but it is something that could be discussed if you feel like the anxiety is so high they need added support. Some things that we would want to do in those individual therapy sessions and even in the therapeutic support group include teaching distress tolerance skills. How do we handle the emotional distress that comes with being pregnant after loss? Emotional regulation skills. How do we handle our emotions? And research has shown that mind-based stress reduction, so like any mindfulness exercise has helped, and advocacy, teaching them that they can advocate for their needs. Some complementary medicine that has helped is the mindfulness, again, relaxation techniques, meditation, acupuncture, yoga, and spirituality. Ways providers can help reduce anxiety is the acknowledgement of their grief and their fears. Don't dismiss it. Tell them that it makes sense. Lead with empathy. Rana talked about this, but just lead with an open heart and a curiosity and an empathetic stance, and you'll get a lot farther than if you didn't. This is a big deal for them. I had the pleasure of help facilitating the Return to Zero retreat, and it kind of relates to this too, but we had a bereaved mom there that said a beautiful thing when we were talking about comparing losses, like, is your grief more intense if it's an early loss or a later loss? But this goes back to leading with empathy too. She said, no matter what your loss is a 10. It doesn't matter if you lost your mom or if you lost your dog and he was your best friend, or if you lost your baby at first trimester versus you took your baby home. To you, your loss is a 10. And I think if we can treat our clients with leading with empathy, that this is a 10 experience for them that they need support on, we're going to do better service to our clients and build that relationship that Rana was talking about that's so important in helping mitigate some of these symptoms later on for PMADs. Okay, the other one is provide concrete medical information. When these women walk into your office, they're full of anxiety. I always thought I was going to puke every time I went to the clinic before my appointments. And you have more appointments sometimes when you're pregnant again after loss. And so my anxiety is already ramped up, and I might not hear what you're saying. So I need you to take time, lead with that empathy, but also provide concrete medical information and maybe take time to answer my questions. And then remember that lost moms need reassurance. So there's this woman named Jessie that is my guardian angel. She's a nurse who was the person who manned the nursing line when I was pregnant again after loss. And we talked about weekly, and she knew me, but she was able to give me that reassurance and meet me with that open heart that I was able to get through. Or I knew that if I need it, instead of going on Google, it's not in this PowerPoint, but don't let them go on Google. I always say Dr. Google doesn't have a real medical degree. I would call her, and that just her talking to me and knowing my story and being empathetic and providing reassurance and saying, yeah, we can run that extra test, or how about you come in for that extra Doppler visit so you can hear the heartbeat because you're not far enough along to feel any movement. Let's get that set up. And that really helped reduce some of my anxiety and get me through. So recommendations from PAL moms and also from the woman who runs the Rainbow Clinic. I have her information in the references, but I don't know it off the top of my head, are that realize that extra visits are going to probably be needed to your healthcare professional. Those telephone calls that Jessie gave me, extra and supportive telephone calls. Make sure, in some ways it's good for ultrasound technicians to know the story. I know this can't always be the case, but eventually I requested the same ultrasound technician because I had to have one a week from like week 30 to 37 when I delivered. And I didn't want to have to share my story over and over again. I mean, I did because I know how to advocate for myself, but not all moms know that. So having a technician who knows the story, or at least is willing to check for the heartbeat first. I had a mom who, she was advocating for what she needed during her ultrasound, and she said, I need you to check the heartbeat first. And the technician said, that's not how we do this procedure. And that, I mean, it would have taken like 2 seconds, right? It's not and that would have helped get her through it and reduce that anxiety a little bit faster. So there's some small things to keep in mind that can help. Know that you could come in for heartbeat checks to find the heartbeat if you need to for that extra added reinsurance. So there's a lot of my friends and some clients I knew who are also pregnant after loss had a clinic of care model. So they had multiple providers, OBs, that would work with them during a subsequent pregnancy, and they all ended up liking one provider more than the other. And for me, it was really great to have that consistent provider, and that's what the research also shows, is that if you can have a consistent care provider, an OB who knows your story, or a couple that you can at least get into, it reduces some of that anxiety because you don't have to tell that story over and over again. And then make sure to just tell your clients or understand that it's expected probably to go to the ER and have more L&D visits as you go through a subsequent pregnancy. It's just part of the normal process. The last thing that is really helpful is that increasing support for clients during a subsequent pregnancy. here's where I'm going to pitch my organization a little bit. But in general, it doesn't matter if it's through my organization or where it is, but as long as women can find peer support and support from others and create a community, they're going to get through this experience in much better shape than if they can't and they feel isolated. So what happened also with PALS is that when I went to look at research that showed that if there was actually support groups for pregnancy after loss, there wasn't a ton, or there wasn't as well known, or even online forums. So all of our stuff right now is online, which when someone was like, you should start an online forum, I'm like, no, that sounds like a lot of work. And it's not my way of doing this, but it is what we do now, and it turns out to be safe and regulated. I have my own thoughts about that, but it wasn't what I wanted to do at first. But anyways, research does show that online peer support for bereaved parents, lost parents, specifically perinatal loss, is actually really helpful. So I'm like, okay, well, let's try it this is just the next part in the journey. Why don't we try it for the subsequent pregnancy? And it has proven to be really helpful. We've only been around for almost 2 years, a year and 8 months, and we have over 4,000 members in our 11 online support groups, all through Facebook, which has its own drawbacks, which we're working on, but that's where our moms like to congregate. So we're trying to merge both worlds, but they're moderated. They have trained volunteers who've also been lost moms, who've gone on to have subsequent pregnancies, and some of them are birth doulas and birth professionals who moderate those forums for us. But peer support is so important because realizing one is not alone in this unique experience helps reduce some of those symptoms. So ways providers can help, these are just to educate yourself and moms of emerging resources like ourselves, or if there's a group, in-person support group in your community, know where it is so you can refer them. Even if there's not a group that meets, if you could just know another person who'd be willing to talk to this person who's been through it, that's support starting there. In-person support groups in your area, and also knowing about other bereavement resources. And you've learned about a lot here today. Rana had some in the back of her resources, and I have some in the back of the packet that I would recommend as places to start. We do have, if you are interested and if you run a local in-person pregnancy after loss group specifically, pregnancy after loss, it's hard to find those groups, and there are listings, like I think Ivy and Kylie just came out with a directory for bereavement services specifically in groups in that way, but there's not a lot of just listings for a subsequent pregnancy. So we're trying to bring together, we have a resource list of in your state or around the world, because we are international based on the unlimitlessness of the internet. You can list your online support, or your in-person support group for pregnancy after loss at the link there that I think you should be able to access in your notes that you get through online. But if you just go to our page, it will say in-person support group. Email us that information. You can also find groups that are already listed. Like I said, online support for the perinatal bereavement community actually has proven through research to be really helpful. So we tried to do it, offer it for subsequent pregnancy. One reason it's helpful is because factors that get in the way of women going to in-person support groups is grief is hard to get out of the house with. You might have other children, and it's a small community. It happens to a lot of people, but women being subsequently pregnant at the same time, it's not a lot in your area. I've helped run in the Twin Cities subsequent pregnancy after loss groups, and the Twin Cities is rather large, but there's only 2 women that came to our in-person support group. Work restrictions get in the way. You also have questions 24/7, so having a group online that you can go to, it might not be the best because it's not in person, but being able to make those connections and have your questions answered when you're during a pretty anxious time is a place to start. So we have 11 private Facebook groups that are all moderated at PALS. It's in there, and then we have a quote about how community is important. The last part I want to address real quick, because I know I'm running out of time, is that birth and postpartum should be taken into consideration during subsequent pregnancy as well, because women who have a subsequent pregnancy, even after, and Rana put that slide up there, but even after a live birth, they're at risk for PMADs. Sometimes that re-grief happens. Sometimes the anxiety from that pregnancy carries over into the postpartum. I know it happened for me. I didn't sleep for a while. I was always afraid that my baby was going to die in the night, because now you're in the community of loss and you know all these stories, and because statistics don't matter, they could happen to you too. So my anxiety was really increased, and what did eventually help was individual therapy and then medication at some point. But the idea is that teaching, it was helpful because I knew that, but some women don't know that that can be a factor. So things that providers can do is teach women that PMADs are could happen based on your experience, and that you're at an increased risk for experiencing those, and how can we be preemptive in preventing them. Reassure them that it's normal to be somewhat anxious, but also know when to seek help. Other things that happen is right at birth, you might want to understand that some detachment after birth can be normal, but it should dissipate over time. So if it's not dissipating, that would be also another place to search for more help for this mom to get intervention so that we can build that bond that happens right after birth. And then again, like I kind of talked about, anticipate anxiety during early parenting of this baby. And again, lead with patience and understanding. The one quote I had on here, I don't know where it went. This was really helpful, and it goes around the internet kind of fast, but it kind of proves the point. Remind them that this is a different baby. This is a different pregnancy with a different outcome and a different ending to your story, because that can help change the narrative as someone brings a baby home. Because we're afraid that the same thing's going to happen when, statistically, that isn't always true, but remind them in a gentle way that it's just a different baby with a different story. And I don't know, I think it'd be good to, this is just a side note for me, but I think it'd be good to educate pediatricians, because you move from your OB to your pediatrician as soon as your baby's born. I know we're educating them about PMADs, but making sure they know that what is the pregnancy history of this mom and dad that are coming in. And I was up front with my pediatrician. I said, listen, she has a sister, she died, stillbirth, I've been really anxious pregnancy. And then I come in thinking my kid has all these, she's like 8 weeks old. I'm like, does she have autism? So I have high anxiety, right? Because I just can't stop the anxiety. And I told my OB up front, I said, how can we work together and you knowing that I have this anxiety? And I think just knowing, and our providers knowing to take time with us because we've had a loss, even when they're the pediatricians, can be helpful as well too, not just your OB. So walking away with key points, understand the difference between grief and mental health symptoms. Remember to normalize grief as a unique experience and a healthy response to a pregnancy loss. Nurture that grief, reduce that anxiety, validate their experience. If you can do anything, just validate that this is hard. Offer resources for support, encourage them to advocate for themselves, and normalize that pregnancy after loss as a unique experience. And lost moms are at a higher risk for anxiety and depressive symptoms after a loss and during a subsequent pregnancy. So that's what my family looks like now, and it is growing, as you can see, with my little baby bump. And then PALS is growing too, which is a nice legacy to both my daughters. So what we've included in here are other resources, Still Standing magazine that I mentioned, pregnancy after loss. There's some links you can go to, mental health for postpartum. And then we have this sheet on our website that you can download, but it's in your packet. 10 facts about pregnancy after loss that we share around as a graphic. And then these tips for health professionals. And if you're interested, we have rack cards that you can take in the back and some on your tables that you can give out to your clients that are going through a subsequent pregnancy. So with that, thank you for your time and inviting me here.
Thank you so much, Lindsey. And I don't know about you guys, but I think any pregnant woman who provides a speech or a keynote like this deserves a second round of applause, because it's hard to do. You did a fabulous job. Thank you so much for sharing all that you did. Instead of giving you a book, we're going to actually order Lindsey something from our online gift shop. And I think this little onesie that says, "Keep calm and carry me, Mom," organic little baby bodysuit, will be a fun gift. So we're going to have that shipped off to you.
Thank you.
Thank you so much. And we'd like to now invite Dr. Limbo up as well and take some time for some questions for either one of these ladies. There's a lot of really incredible information that's been shared. So any questions? Well, I know I have one, and I know there are a few others that aren't necessarily clinicians in the room. there was a slide that you put up, Dr. Limbo, a few slides into your presentation that listed all the types of loss. And there was one that I didn't recognize, and I can't even recall what it was. Molar. Would you mind sharing what that is?
It's a molar pregnant. Let's see if I can do this and do it justice. It's a pregnancy that forms as a sort of a series of cells. The woman actually is pregnant, but it's not. It doesn't form into a baby. But the pregnancy was there, and it can be located in a number of places. There, you saw that they weren't really common, but we need to be cognizant. Even though it's not common, it doesn't mean that there's not some feeling of sadness and loss. So there would not be a visible baby, but yet the pregnancy occurred. So, and then someone had gotten, I think Kelly told me of a question from the Colorado group. Hello, Colorado. About fathers, and there's more and more work being done in that area now. But here's the one thing that I'd like to share, because it's some newer research, and I think it just fits so well with my personal experience as well. I used to, for many years, was a facilitator of a perinatal loss support group, men and women. And one of the things I noticed was it seemed so often like the women were grieving initially, and then later on the couple would continue to come, and then later on the father was starting to have tears. That was exactly what happened with Anne and Betsy, the mother that I showed you the photo of, or excuse me, the video of the feeding. We did a presentation together after Betsy was a year old. He could barely talk. He could barely talk through it. He was so sad. And by that time, Anne is feeling much better and her depression's lifted and all that. So this new research talks about sort of an oscillation model. It's something that Straby and Schutt, who are from the Netherlands, have talked about a long time ago. In '99, I think they first published it, about how grief is. It's restoration-oriented or coping-oriented, and so one day is a very tearful day and another day is more joyful. But it's back and forth, and that same model, I think, can be applied when it's a couple. It does not have to be a heterosexual couple, but that one person may indeed be expressing more of the grief while the other one is expressing more of the coping, and then they switch. So that's something I think that's very helpful to know for couples.
Thank you. Hi, my question is, do you find working with women clinically that are experiencing pregnancy after loss, that they respond better to that consistent, if we're doing individual therapy or group therapy, what do you find is the best modality? Or kind of dependent on the client's particular issue?
You know what I'm going to say. It's dependent on the client probably and on their preferences. I know that I did run a bereavement group for a while. I stopped when I got pregnant because it just didn't seem like the best care model. But women said that what was most helpful for them during the bereavement was also their individual therapy, but I think the support provides that added validation that I'm not alone. When I did run the, I think individual weekly therapy for some women, depending on the level of their anxiety, would be most helpful. And then the model of the therapeutic support group that we ran with Joanne O'Leary, because she really recommends a therapeutic support group for pregnancy after loss, which just isn't always possible depending on the resources and setting, also meets weekly, which is one of the challenges as well too. And we had women in that group, well, the two women, one that did individual therapy and then found the support group also helpful. So it really depends on what they're presenting with, but I think both can be helpful, and at least getting involved in some kind of support it will diminish symptoms.
And just to follow up on that, have you ever done a couples support group for pregnancy after loss?
So Joanne has done those in the past, and I've talked to her about that. And we had some sessions where the men or the dads would come in or just the partner in general, but we had mostly dads, would come in and they would then talk about specifically around birth planning, what that would look like, and then how to talk about some of their fears. I did want to separate them for a while and then bring them back together when that would happen. But the men seem, I don't know if you found this as much too, seem to be more talkative when the women were actually around. So I don't know how you do it in the bereavement model. But
I also wanted to just say one thing very quickly. For those of you who are here tomorrow, I'm going to talk more about this, but you have on your table what we call a PRAM card. And it really is a grounding mindfulness. It's a badge card if you want to use it for that. You can a badge this way or a badge that way. But it's for pause, reflect, acknowledge, and be mindful. And we have found that this can be something that I wear it on my badge all the time, and if I'm thinking about making a hard telephone call, it's just a bit of thinking about it, taking a deep breath, thinking about pausing, reflecting, acknowledging, and being mindful of the moment, and then setting it down. And so anyway, I wanted you to have one of these, and I hope that maybe for your offices or whatever, you can set it there and it'll help. But I'll talk more about this tomorrow.
And one thing going back to dads, and then we'll go over there, is that we actually have a PALS online support group for dads that are during subsequent pregnancy. It hasn't taken off, and then we're actually in conversations when we're going to be starting up a Smart Patients forum so that we have online groups that are not linked through Facebook for women as well too, and that should launch soon. But when talking to the founder of Smart Patients, he's also found that socially dads just don't grieve on social media or reach out in the same way. So that's an interesting fact relating to that, but they still grieve. So that's why we don't have as many supports, or we try to have those supports. We have some dad writers, but it's definitely, like you said, a different process.
I also just wanted to compliment you. I've been in this field for a very long time, and pregnancy after loss has often been neglected. And I think that Lindsey brings something to this that I've known her now for a little while, but I really admire her work. And I think that you can safely hear what she has to say, use these materials, go online, recommend all of that, because she's exactly who she seems to be. And we need you. And we're very grateful to have you in this field because it's been a very neglected area, particularly for the mental health issues, which you know so much about.
There's someone over here.
Oh, Joy. I know what she's going to tell.
Yeah.
There's a mic.
I very much appreciate this. One of the things that I am very interested in because of what we do where I work is the loss issue for parents when they have a child who's born with a physical handicap or they're born with Down syndrome. And working with regional centers, they tend to head straight to how do we support the child, and moms get overlooked. So I've always looked for, is there a support group model that's for that population?
I don't know one thing. Go ahead. Okay. I only know of one thing, and it's a recent, I don't know it off the top of my head, and I can email Kelly, but specifically for parents who have a child born with Down syndrome in Minneapolis, it's kind of similar to PALS in that it's Moms Leading Moms crusade, but they have like a mentorship program where moms can kind of come together and talk about the struggles that entail and the grief that's involved in raising a child with special needs. But I don't know if there's actually a group out there for grieving that type of loss. That'd be really interesting, and I'd love to learn more about it and list it as a resource because I think it is a loss of expectation, like we talked about with when you lose a child and the expected outcomes during pregnancy. So there's a lot of similarities. Thank you.
I am so glad that you mentioned that because I'll be very quick. An experience I had quite a while ago was a mother and father had a baby born with Down syndrome. It was before testing. They didn't know and all of this, and so they had just found out. And then someone thought it would be a good idea for someone who had a child with Down syndrome to visit them. And I have never seen, I really think that this is true, anybody that was that devastated. No one checked, are you ready for this? Is this what you need? And they weren't. They were grieving intensely at that moment and thinking ahead to this will be fine and, it's wonderful and all of that. They may well have reached that, but we inadvertently injured them. And it's something I haven't forgotten. So I'm so glad you're asking about that, to deal with the grief and to find out where they are in their process.
We can take one last question. Yes.
My name is Wendy. Hi. And I have a question. I had a stillbirth, and I'm wondering if you've come across this before or heard of this, but I had an out-of-body experience, but it was so blissful. Like I went up into the higher realms, and I came back a different person. So for me, the hard part was I was blissed out after the birth, and nobody could relate to me, and obviously I just couldn't find help. But is that at all common?
Okay, we both have something to say about that. One of the things that you had talked to me about briefly at the break was that I had not talked much about joy, and that joy is very much can be a part of this whole thing. Not necessarily, but the mom who talked about the nurse patting her baby on the butt when Sarah died, and how that was so reassuring to her. She also, in that same video, talks about the joy that was in the room. But it was oscillating. You know, she said it would be horrible sadness and tears, and then there would be joy and laughter. And I think it's such a critical thing to know about, because it does call for you as a care provider to be able to be where people are. And I guess I haven't heard exactly what your story is, but I certainly, and Kylie talked about that too, it can be dissociation, or you can call it out of body or whatever, but you go somewhere else. And for you, you came back joyful. And I think everybody must have missed it. Is that kind of what happened?
When I looked for therapists and things, they couldn't even touch it, because it was more of a spiritual experience in a mental health setting, and they didn't know what to do with it, or the stillbirth, really, at that point, 20 years ago.
Yeah, I have read articles by women on still standing. Tara Schaefer wrote one specifically about a similar experience. She talked about it, her birth of her stillborn baby, her second child. She runs Reconceiving Loss, which is also a resource, and she's a great writer. But she talked about how she had a near-death experience, but that it wasn't scary. It was almost, like you said, like spiritual in nature. And I know that one from my own personal experience. Like, I knew Nora was going to be born dead, but the first thing I said is, she's so beautiful. So there's that mixture there. It was still joyful. It was one of the most, I'm going to tear up, sorry. It was one of the most beautiful moments in a tragic way of my life. So I think in that way I can relate to what you're saying. And I have heard other women say leaving their body from a trauma response, but also having like that near-death experience that wasn't scary.
Thank you.
Thank you all for such rich questions, and thank you again to our two speakers. Can we give them another round of applause, please? Thank you.